Welcome to 10th and final lesson of the EFN Digital Skills for Nurses. In this final lesson, we will give you some examples of the digitalization of the healthcare systems in the EU. The EFN project ENSA for Care analyzed how nurses and social workers could use technology in a cost-effective way to enhance their practice, empower and educate patients and the public in the prevention of chronic non-communicable diseases and thus healthy lifestyles. For example, in Norway, an app has been developed called eRehab to help in maintaining physical activity following cardiac rehabilitation. The intervention, designed in collaboration with users, has the potential to reduce the number of face-to-face visits and rehospitalizations and improve quality of life through increased levels of physical activity. Or the Heritage platform, based on scientific evidence from the Framingham Heart Study, which provides a simple way of estimating and expressing CVD risk in a way that is easily understandable for the individual citizen. It has been used by more than 6 million people around the world. In Belgium, a telecare system by electronic tabs for nurses and other personnel in emergency services for thrombosis has been in use since 2014. The telecare system is situated in the ambulance, and through using a 4G internet connection, patients can be in direct contact with the thrombosis specialist before coming in the hospital. This not only improves quality and efficiency, but also prevents long-term ill health as a result of delayed treatment. In Estonia, qualified family nurses working in areas with low populations are supported through a collaborating platform solution. In areas where the emergency care is led by nurses, they can connect healthcare professionals to the platform and where emergency assistance is provided. Digital information, image, sound and video transmission can take place through the system. In cooperation with the program CONUS, certain nursing codes have already been digitized and the work continues. The goal is to add the most important nursing activities into the app so that the nurse can check the correctness of the activities performed before or parallel to the procedure. In Finland, development occurs at multiple levels. Of special note is the development of the Virtual Hospital 2.0 project, which is created in collaboration with all university hospital districts. The project's central outcome is the Health Village digital health service. It provides information and support for citizens, care for patients, and tools for professionals. The service comprises various themed virtual houses, some of which are already open. By the end of 2018, more than 20 houses and services have been available for more than 30 groups of patients. In the UK, examples of virtual coaches include Sense.ly. This offers an avatar-based care approach in the form of a smartphone app and a virtual nurse. This system allows a clinician to monitor a patient's personalized care plan after being discharged from hospital, or alternatively, the virtual nurse acts as a gatekeeper in a triage system. A patient can check in with their nurse avatar and report symptoms, medications, etc. Clinicians can monitor risk factors and adjust clinical protocols accordingly. In the UK, for example, the Chucolane practice serves more than 5,500 patients, and it is one of the few practices in the UK to be nurse-led rather than run by GPs. Not only is the practice run by 2 nurses, Most of the appointments are carried out by nurses too. These nurses have received extra training so they can do most of the work normally done by GPs, such as prescribing medication. Also, the Queen's Nursing Institute promotes community nursing specifically to nurses, employers, educators, and policymakers. They have highlighted the complexity and high quality of nursing provided by district nurse working in the community. An example from Croatia sees such technology enabling patients on the various islands to have follow-up care, while in Denmark, telenursing has been instrumental in supporting individuals with diabetes or chronic pulmonary diseases like COPD. E-health in this context has been especially useful in advancing the work of nurses via enabling direct communication with patients in remote areas via webcam, conferencing, exchanging advice between community nurses and more specialized nurses in hospitals, participating in discussion on various patient cases, and even transmitting patients' data like X-rays, test results, or bound images. For example, Finland has nursing reception facilities in smaller health stations which are supported by e-consultations with doctors if necessary, with only 22% of patients sent by the nurses to the main health station to be seen by a physician. A key outcome of a truly integrated system is the improvement in the quality of care for patients and their family members. One example of how this is realized comes from Ireland, where a Quality and Clinical Care Directorate was established in 2010 to help improve the patient journey through the health system. 20 integrated patient care programs were established under the leadership of a multidisciplinary team of clinical professionals, including clinical nurses, specialists, general practitioners, consultants, and allied healthcare professionals. Such programs focus on improving care, significantly reducing waiting times, cutting out inefficiencies, and being cost-effective. Integrated care programs include such areas as heart failure, stroke, acute coronary syndrome, COPD, asthma, rheumatology, primary care, epilepsy, care of the elder, and emergency medicine. Clinical nurse specialists and APNs in these programs work within a multidisciplinary team and play a lead role in rolling out these programs. In Germany, one example is the implementation of a coordinated approach combining all health professionals and health institutions in one city in northern Germany towards pain management. The project is titled Pain-Free City Monster and is led by a nurse researcher. In Denmark, there is a strong focus on telehealth, used for patients with chronic disease, especially COPD patients, in the treatment of chronic wounds and physical training. Telehealth allows the patients to remain at home and it prevents hospitalization. Furthermore, electronic patient records and electronic overview of the patient's medication are an established practice in Denmark, which ensures easy access to patient data for both the patients and health professionals. In Czech Republic, for example, the transplant ambassador makes use of patients' own data to improve their knowledge about their condition and their recommended treatment options for irreversible kidney failure. This allows the patients to be more autonomous when making decisions about their future treatment, including about kidney transplant from a living or a deceased donor. Over 100 nurses working with the target group in nephrology practices and hemodialysis centers received specialist training in this area and were involved in this project. These nurses discuss the treatment options with the patients in detail, which empowers the patients to be actively involved in their treatment. In Iceland, together with the growing number of CNS and APNs, there has been the development of nurse-led clinics, where there is a special emphasis on assisting patients and their families towards greater self-management, particularly in relation to the treatment of long-term illness. Nurses-led clinics are operated either in collaboration with hospitals or primary health care centers as outpatient clinics for a range of patient groups and their families. Nursing therapy based on the ideology or models of self-management is practiced in these outpatient clinics. Examples include clinics for patients with chronic pulmonary, cardiac and renal diseases, diabetics, the parents of infants with sleep problems, parents experiencing dysphoria during pregnancy, adolescents and patients with urinary incontinence and chronic ulcers. In the context of digital skills for frontline nurses, Be Well is playing a key role in developing the right and the necessary skills for allowing nurses to use innovation for facilitating their frontline work life. In this first year of project, DFN and the other partners involved in the Be Well will develop two versions of the skills strategy. The first version has been created using Be Well Consortium member expertise and skills intelligence gather. It will be shared broadly with the public to gather feedback from all stakeholders. Concurrently, the Be Well project will pilot new qualifications and the results of both initiatives will be incorporated into the second and final version that will be published in June 2026. Another key point developed in the Be Well project is the Skill Monitor, which is a web-based tool that captures and facilitates comparative analysis of digital and green skills training programs in Europe and other countries. The goal of the monitor is to provide an overview of upskilling and reskilling possibilities to empower the digitalization and the ecologicalization of the health and care sector. This includes everything from lifelong learning, continuous professional development and continuous medical development programs that are focused on digital and green skills. The Be Well Skills Monitor is regularly updated. Another achievement of the Be Well project in its first year is the establishment of a pan-European multi-stakeholder partnership on health workforce upskilling and reskilling, launched to support the twin transition to a green and digital economy, with the aim to make EU health systems more competitive globally and enhance Europe's open strategic autonomy. Thank you all for following this final lesson and the entire EFN course on digital skills for nurses. Remember to have a look at the additional reading and learning materials to continue learning. Thank you again for the attention and for the time. And to close this first EFN course on digitalization, we want to remind you how important innovation and digitalization are to help support and facilitate the frontline work of nurses. To make the process work, however, it is necessary to involve those who are up on the front line every day, taking care of patients, risking their own life, the nurses. And indeed, this is possible only by engaging nurses in co-creation. Nurses really know what the healthcare ecosystem needs and where digitalization could be helpful and essential for achieving better health and care outcomes. Deploying artificial intelligence to improve the healthcare outcomes implies involving nurses in all the creation and the designing process, starting from the conceptualization. Another important point to keep in mind is to give nurses and allied healthcare professionals a clear overview and evidence on the potential of these instruments prior deployment. It is essential to highlight how these artificial intelligence tools can facilitate and support their daily work. Digitalization and digital tools are useful only if they support nurses to deliver high quality and safe care. EFN, representing 3 million nurses in the EU and 60 million in Europe, supports the boost of the digitalization process and in particular the engagement of nurses in co-creation. It is necessary to create the right digital instruments which can facilitate and support nurses' daily operational activities service. This is an initial and essential step for creating sustainability and resilience of the healthcare ecosystem and healthcare professional workforce. Thank you all for participating in this course on digital skills for nurses. See you in the next course. And remember, nurses' voice matters.